What you're about to hear is a discussion about personal experience with cancer. We're not medical professionals, and at no point are we making recommendations for diagnosis, treatment, nor care. All opinions are highly personal as each individual experiences mental and physical side effects of cancer and cancer treatments differently. We're only here to listen, discuss, and break the social taboo of cancer.
Hello.
Hi, Zach. It's great to meet you. I know that you and Des have chatted before, just like super briefly
Mhm.
to get to know each other. But I'm so happy we get to talk with you. And it is a bit of a different convo this time, and we'll let the audience find out why. But it's a little bit of a different chat, but we're still so happy to be talking to you and to hear your story.
Thank you. Yeah, thank you for having me on.
So it'd be really great to just hear from you how this all started for you. Like, what was the first part of your journey like?
Yeah, so the first part of my journey is I'm a mountain biker, and since I was riding at the time of like when this all went down, I was riding at a local place and I did a gap jump. I came up short, didn't make it, and I got airlifted because it was getting late and it was just not an ideal position I was in. I was under power lines and we didn't really know what to do because this was like the first like major fall that I had on my mountain bike. So my mom, she worked for the fire authority at the time and she was like, "Hey, can some like a helo go out there and pick my son up? You know, he got hurt." So they came out and they picked me up and airlifted me to Mission Hospital. It's in Mission Viejo, California, and they are a trauma hospital. So when I got airlifted to the trauma hospital, their protocol was to get me a CT scan from head to toe, and that's how they discovered what was going on. So when they took that CT scan, they were like, "Okay, there's something in this kid's brain. Let's see what's going on." So they took me down for an MRI, and that's when they discovered a golf ball sized brain tumor.
Wow. That's a very dramatic way for this all to begin.
Oh yeah, yeah, it was very abrupt. So I mean, taking it back to even 6 months, 3 months prior, even the day prior, I was normal. You know, the day prior, I had a rugby tournament and I played rugby and I was perfectly fine. So none of this was sort of like we could see the signs and symptoms of it. I was asymptomatic. I complained about a headache, but that was because what I thought was dehydration, but the headache was in the back of my head, and that's where my brain tumor was, and little did we know that it actually was the brain tumor.
Mm. I mean, like, terrible accident, but also kind of like a happy accident that you were able to, like, catch something a little bit, earlier than it's just interesting to me when when it's not symptomatic, it almost feels like something has to happen for you to find out because 'cause you're not gonna go to the doctor and be like, "Hey, I have a slight headache
Oh, yeah,
sometimes."
yeah,
Like
for sure.
yeah, but how were you physically from the actual accident? Because it sounds, like, quite dramatic.
So from actual accident, I wasn't hurt that bad. I bruised my pelvis. That's why I got airlifted in the first place. I couldn't really walk that well, and all the
Mm,
other mountain bikers say,
mhm.
like, it was probably an internal injury, and everyone around me was like, "No, stay down. You got an internal injury," because most injuries that happen in mountain biking that are serious are internal, just because like, the impacts,
Oh.
but it wasn't internal, thankfully, and I was completely fine from it. I couldn't really walk, that was part of my pelvis, it being bruised, and I was slow to get around later at the hospital, but I wasn't able to walk, like, when it first started.
Mhm. Okay. So, I guess because it's a trauma hospital, they probably did these tests for you, like, right away, right? Like, as soon as you got there, you did the tests?
Yes, they did the test right away. I went from helicopter to trauma bay, and that's when they cut off all my clothes and put me in the hospital gown. But
Mhm.
the clothes that I was wearing, I just got them for Christmas. So the mountain biking accident happened on January 16th, and the prior Christmas, I got all those clothes, like a brand new riding kit. It was like $300, and the first ride that I rode on it, I got it cut off me by a bunch of doctors. So I was a bit irritated and pissed off that that happened, but I guess they wanted, me to be still and stable, and I mean, if it works for them, I guess, right?
Yeah, like, for your own good. They were like, "We don't care about your cute clothes."
Exactly. I was able to move around. I was like, "I can take them off." They're like, "No, we're cutting them off." I'm like, "Ah."
Oh, okay, that feels extra. That feels
Yeah.
really extra, but
Yeah.
okay.
Yeah, I know. I was like, "Come on, guys." But yeah.
So once they did, the scan, I guess was that so you said trauma bay, but I'm sorry, I don't know what that entails. So was that where they did the MRI as well?
So the trauma bay is where they did the CT scan. They have a CT room that I went to, and then they took me back to the trauma bay, and then they brought in a couple of doctors to talk to my parents. They took my parents out of the room.
Mhm,
They told them what's going on. They didn't tell me what's going on, and then they ordered an MRI on me for, like, I thought it was for no apparent reason. So I went down to MRI. I was kind of like, this is a little bit like extra. And then I was like,
mhm.
okay. Took the MRI, and the MRI showed a golf ball sized brain tumor lying between my cerebellum and brainstem.
Wow.
And, just for context, how old were you at this time?
I was 17 years old, so I was right on the edge of being a pediatric, but it was a pediatric brain tumor. Uh, and right now I'm 23 years old, so this is about 6 years apart, right? Six, yeah.
Mhm. Oh, that's interesting. So they were able to tell that it was a pediatric brain tumor, or I guess it would have been considered that because it would have grown earlier?
Yeah, so the reason you can tell between the distinction, I'm not a medical professional. This is what I was told, and this is the information I'm giving out, but I'm told that pediatric brain tumors happen in the back of the brain, and like in the back of the brain, and the adult brain tumors happen in the frontal lobe of the brain, or like the front of the brain. And what I was told is that pediatric brain surgeries happen with the patient completely out, and adult brain surgeries happen where the adult still has to be awake because they're cutting into the part of the body that like has like motor function and everything. So they have to make sure they're not cutting too deep or not doing anything.
Like, I've known that because of movies, but that seems so terrifying to be awake. Even though I know you feel nothing and, like, you're just, like, but just I don't know if my brain would be able to stop from thinking about, like, what's going on back there.
Yeah, exactly. I was so happy that never happened to me. I never had one of those surgeries where I had to stay awake.
Thank God, yeah.
Yeah.
Well, did they, so first of all, how did you process that information? Because it just came out of the blue completely for you.
So my thought processing wasn't very good at the time, and I didn't really think of it as much because I still had the I'm a teenager, I'm invincible mindset.
Mm.
So I kind of was like, oh, I had a
Hence the
brain
mountain bike
tumor.
riding?
Yeah, yeah, exactly. So I was just like, okay, well, I'll just get done with this brain tumor. And I didn't think of like it being a big thing. I just thought
Mhm,
like, oh, I have a brain tumor. I'll get over it soon and I'll be back doing my own thing, right?
mhm,
But it turns out it was this whole big ordeal. And I was like, okay, maybe this is not gonna go by quickly. And
mhm.
it didn't go by quickly. So yeah.
We do wanna unpack that, like, whole process, but it's good to know your starting point of, like, "I'm just gonna get past this and we're gonna be good." Um, what did they tell you? I guess they had to keep you in the hospital, right? Was there, like, a surgery right away, or, like, what was that process like?
So the night that I crashed, they actually were prepping me for surgery because they
Oh.
wanted me to have surgery. But the only problem was I didn't have a neurosurgeon to perform the surgery. And the neurosurgeon didn't come in till the day after. So they had to keep me overnight. And then the neurosurgeon came in, but he was going on a trip for his anniversary. so he wasn't gonna be there during the week. So he told me that he's not gonna be able to do the surgery until the following day, or not the following day, the following week because the trip that he was taking. So I had to wait an entire week, but I wasn't in the hospital for this. I went back to normal life. I went to school the not the following day, but the day after. The following day, they instructed me to stay home. Actually, well, they instructed me to stay home the whole week. But since I was so bored, I was like, no, I'm going to school. So I
Mhm.
went to school the next day. I did everything normally. I didn't participate in football. I sat out and I did everything like normal besides the physical activity aspect of it. And things were pretty normal and I didn't think of anything differently. I had my pre-op appointment on the Friday before.
Mhm.
So it was I crashed on a Monday. I stayed to a Tuesday and then I stayed home on a Wednesday, but I was like, no, this sucks. And I went to school on the Thursday and then on the Friday I had the pre-op appointment and then it was the weekend and then it was surgery on Monday.
Okay. Okay.
When you went to school in those days, did you tell anyone what was going on?
Well, since I was on the football team, the news kind of spread like wildfire throughout the school. No one really knew besides my closest friends, and they kind of told their friends, and then it just blew up out of nowhere. So by the time I was back on campus, I was saying hi to people, and they were kind of like shook that I was there. They were like, "Don't you have a brain tumor? Like, what are you doing here?" And I kind of was sitting there. I was like, "Well, yeah, but it's not coming out till Monday, so I'm just gonna go to school, gonna live my life, and not not accept fate and be like, "Oh, it's coming and I'm gonna die." Like, I'm just gonna go out there and live my life.
Mhm. That's amazing. That, like, level of just, like, being, like, so strong-minded that you could just, like, go ahead and live your life. That's just, like, and I'm glad you didn't have to wait for too long, so
Oh, thank you. Yeah, thank you. I've noticed pediatric hospitals and pediatric patients, they tend to do them quickly. They tend to be like, "Oh, kid needs a can't this kid needs treatment or this kid needs surgery done." Like it's done. I've noticed the big difference between them and adult world is the wait times. Because
Mm,
we'll get onto it in the story, but a little later in life, I needed a surgery, and they were like, "Oh yeah, we'll schedule it." And the scheduling took like 2 months, and like I was like, "What happened to the urgency here?"
mhm.
But yeah,
Yeah, you grow up and realize you're not as important anymore.
exactly. Yeah,
So how did that first surgery go?
it went in my eyes. It was like it was kind of like a double edged sword. It went good and it went bad. So the good part was they got 99% of the tumor out, and I was able to kind of recover after that. The bad part was I didn't recover for about 4 days. I was kind of in a medically induced coma for 4 days,
Mhm,
and I was heavily sedated. So I wasn't really able to do anything for those 4 days. And then later found out the following week that the first surgery also gave me bacterial meningitis. So it kind of turned from one issue into another. And then later on in the story, you'll find out that issue turned into like 50 other issues. So it was kind of like an uphill battle from that first surgery.
how do you get bacterial meningitis? Did they explain that to you?
So I think that I don't know. Legally, I don't know if I'm allowed to like say too much,
Okay, fair enough.
just
That's
because
fair.
I'm not for certain about what happened. We have speculations on what happened, but we're not too certain on what really went down, and we don't know. But
So basically, it's a result of it's usually a result of something going wrong with the surgery. It's not like a side effect of
mhm,
yeah, okay.
I'm not sure if it's the same in the States, but I think in Canada, like, before you get a surgery, they always tell you there's, like, a small chance. I'm trying to think if they even make you sign something. Like, I'm sure there's paperwork or
Oh,
something
yeah.
that's like, there's a small chance, yeah, that you might get some sort of infection, but just to cover themselves, I guess, is what
Oh,
that
yeah.
is.
Definitely. We had to sign, like, 7 or 8 different documents kinda
Mm,
claiming different stuff, and there was one document I do regret signing. It was the consent to arbitration. That document I do regret signing, but, it's in the past, and I'm
mhm.
doing well now, so, I mean, I can't really look back on it too much, but that's one thing I do regret.
I mean, it's also just something you really don't think about in that moment. Like, you have a tumor in your head, like, you want that out.
Mhm.
You're not really trying to think about all the paperwork you're signing, which, like, I mean, it's a lot to expect of you, and you're also 17, and it's a lot of your parents to expect of your parents or your caregivers because they're also, I'm sure, emotionally going through a lot at that time.
Exactly, yeah, and at that age, I wasn't able to sign anything because in California, the age of
Oh,
consent
yes.
is 18, so
Right, right, right.
I couldn't sign any of the documentation, so I was kinda, like, just, relying on my parents. I was like, "Yeah, sign this," like, because I didn't know what it meant, so
Yeah,
I was relying on them, and I was like, "Well, put me in good hands."
yeah. Okay. Um, so once you like you said it took about 4 days for you to recover from the actual surgery, and then is that when the symptoms of the infection started to kinda show?
No, so it was 4 days of me being out, and then on the 5th day, I woke up. I also got discharged that day.
Mhm,
And I went home and I started my regimen of physical therapy and I did everything normally after that. But it kind of was halted after about 10 days. That's when the symptoms started showing of the bacterial
mm,
meningitis. I was at a post op appointment with my neurosurgeon when I was feeling all right. And then I started feeling terrible. So I was feeling terrible. He had me lie down. And then I felt good enough to leave, and before I even left the parking lot, like, it went so south and it was just vomit everywhere, and yeah, it was not a good time,
mhm.
and that's when my neurosurgeon was like, "Alright, go across the street back to the hospital, we got a bed waiting for you." I was like, "Oh my gosh," back in there. So, I went back in there, and then I was on the operating table, I think, the following night
Mhm,
to put in an EVD, which stands for an external ventricular drain. And
mhm,
what it does is it drains your CSF, your cerebral spinal fluid,
mhm,
through an external drain, and it
mhm,
drains that way. So they put in the EVD, and then after the EVD, they wanted to do an endoscopic third ventriculostomy. So that was a catheterization of the cerebral aqueduct. So it was kind of blocked up, and I had hydrocephalus from the bacterial meningitis. So after that, I was there for a day of monitoring, and it looked good. So they sent me home, and then it was about a couple weeks where I went home, started PT, and I was doing kind of normal recovery things when I just became ill again, and that it turns out the endoscopic third ventriculostomy closed up and it caused the bacterial meningitis to come back.
Oh, man.
I was
Mm,
like, so when that happened, I went to go to the restroom and I peed out a kidney stone. So that
what?
the one problem, the brain tumor, turned into hydrocephalus, bacterial meningitis, kidney stones, and they had to put a stent in. So I was back on the operating table in early March of that year for my 4th surgery, and that was a kidney
Jesus.
stone removal, and they put a stent in. And then the following day, since my bacterial meningitis came back, I had an EVD put in, and they also did a redo of the third ventriculostomy. So I was 5 surgeries deep in about a couple months, and I was like, what's going on?
Mhm,
And
Mm.
that's when my prolonged hospital stay happened. Along that time, I had to replace my EVD. So one thing with the EVDs is
mhm.
that after about 2 weeks, they stop working and you have to like replace them. So
Mhm.
after the 2 weeks of my first EVD, they put in my second EVD. So they had to replace that with a surgery. And then it was kind of just waiting. And then so the notice that the third ventriculostomy, so I mentioned that I had a redo of the third ventriculostomy, that closed up again. So they couldn't get my cerebral aqueduct to open. So I had hydrocephalus permanently at that time. And they kind of decided on a VP shunt. It stands for, here, I'm gonna botch this name, but we're gonna attempt it. Ventriculoperitoneal. I think I said it right. That's
I
why they
like the
say,
abbreviated version.
yeah, that's why it's VP.
Yeah.
So I still have it to this day, but on March 20th, that's when they put it in. And what it is, it's a kind of a tube that runs all the way down my body into my abdomen. So from top of the head to the abdomen, it's a tube, very, very tiny tube. It's the size of spaghetti. I think my dad said it was Venezuelan? Venice? It starts with a V. Some
Vermicelli?
I don't know. It's a thin pasta, right? Is that
Yeah.
what it is?
Yeah.
Yeah.
Yeah, I think so.
Okay, I remember the V, but yeah, it's a it's the size of the thin pasta that runs all the way down, and it drains my cerebral spinal fluid that way. And at the top in my head, they put a device where the CSF goes. So it's kind of like a long funnel basically.
Mhm.
Right? So it goes in my head and it drains into my abdomen.
Mhm.
And uh they put it in and I seemed to be okay. And they were like, okay, so let's kind of, you know, get that stent out of your kidneys because you've had that in since March 3rd and it's April 14th. So that's when my next surgery was, April 14th. And that
I'm sorry, what's
was
a stent? Like, what does a stent do inside of your kidneys?
That is a very good question. I still don't know to this day, but I'll give it a shot. I think the stent is there kind of like for the kidney to heal. So I think
Mhm.
it kind of like is a tube through the kidney. And so, like, when they take out the stones, like, there's a bunch of damage on the inside of the kidney and they want it to heal up.
Mm.
So, how they get like the urine not to like flush in the wounds or not to
Oh.
get into them, like, I think they put the stent in. I think that's what it's for. I never asked,
Mhm.
so
Mhm,
I would
mhm,
know, but that's what it was.
mhm,
So, my urologist, he goes in and he's going to remove my stent, and it turns out the stent calcified in my kidney after, like, not even a month. So or
mm.
a little more than a month. So it, like, calcified in there, and it took them 4 hours to, like, chisel it away and remove
Oh
it.
my
So
gosh.
they removed all the calcification, and they put another stent in. They they inserted another stent and a Foley catheter, and I was like, "Oh my goodness, like, can this nightmare end?" Basically. So 2 weeks later, I had a surgery to remove all that, and everything went smoothly, and I got it all removed. I was finally tube free. There was no tubes in my body. There was nothing. And I was able to start the road to recovery.
Mhm,
But in the first surgery, I only had I had 99% of the tumor removed. That 1% was still there. And that was
mhm,
the inoperable part where they couldn't operate on, but they could get it with a centralized radiation, like
mhm,
kind of pinpoint accurate radiation called gamma knife. And that was my 10th surgery. So it was sometime in May of 2017. That's when my 10th surgery went down. And I
mhm.
was able to, like, go through that. Things went smoothly. Well, so I think later on we'll find out what happens. But
I'm I'm, like, still my brain is just stuck on, like, that our brain fluid drains. I'm like, "What?
yeah.
I didn't even know this happens in, like, a normal person." That's wild.
Yeah. Yeah, so our body, so think of CSF as the kind of like oil in a car, and
Mhm.
that's kind of what keeps our brain kind of running, and it drains down the spine, and you know that's how it works. So that's what the whole CSF thing is. And again, I'm not a medical professional, so I could be wrong, but this is what I was told.
And, like, it's interesting to me how, like, just one thing going wrong, this, like, bacterial meningitis leads to so many other issues, like, I guess that's just what happens when, like, the balance of things kind of goes off, right?
Yeah, yeah. So it's actually funny that you mentioned that. A point came to my mind is so at first the doctors kind of didn't get their crap together, and my dad had a meeting with all of them and kind of like yelled at them and was like, "Look, this kid, he came in as a peak offensive lineman, and there was nothing wrong with him. Now he's in the hospital fighting for his life with multiple things wrong with him. This is on you guys. Like, you guys got to get your crap together, and you got to, kind of focus and like be on the same page." And what I mean by that is one day urology would come in, say this issue, and then oncology would come in like 2 hours later and be like, "Oh, I wasn't aware of this issue."
Oh
And
god.
they just weren't on the same page. So my dad kind of had a meeting with all of them, kind of lit them up and like told them, "Look, like this is how it goes, and you guys need to save this kid. Like this is
Mhm.
unacceptable."
I mean, very understandable for your father to even be, like, that rational with them at that point. I would be losing my mind.
Yeah. A lot of choice words were spent that day that
Fair enough.
we're not repeating on here.
Yeah.
Yeah.
Did you ever consider, like, changing hospitals?
Uh, I'm gonna be honest. I don't quite remember from January to about May.
Mm,
So
Mhm.
whatever happened in that time frame it was my parents' decision,
mhm,
and I wasn't in the state of thinking. I mean, I do remember all about 2 minutes of that whole 5 month like period of time. So it's kind of weird, it was definitely a different experience, but I'm able to kind of like my parents documented a lot of my story, so I'm able to kind of read up and like study like what happened and kind of go off of that, and hopefully it's 100% correct, and I trust them, so I'm pretty sure it is.
mhm.
But yeah, so
It sounds like they were, like, very supportive and involved, which is nice to hear. Um, how was your kind of how do you think they were dealing with it, I guess, and how was your relationship? I guess you were just kinda leaning on them because 'cause you're a teenager.
hmm yeah, so it affected my mom and dad a lot. I know that. I know um I know my mom told me there were times where she was tested like very hard, and she would like break down and stuff in like private and not show me, but they're they definitely were affected by this, and I hope that I impacted them as well. Just not by the kid with the brain tumor, but the kid who kind of inspired them out of like resiliency and toughness and strength to do this. And it wasn't just a solo effort by me. Obviously, I had to live through this, and at the end of the day, it is my life, and I was the one like kind of calling the shots. But they were there helping me. We set up a system. My mom would come during the day, my dad would do work, and then at night my dad would be there because there were nurses on staff who couldn't really like they weren't like trained to handle someone of my size. I'm 6 foot, 230 pounds in a hospital full of children, and most of the kids are like 5'4", 100 pounds. So they they had to get a lot of stuff of mine transferred over because they share campuses with an adult hospital. So a
Mhm.
lot of the adult hospital, like bed extenders, like a mobile bucket for waste disposal that like can fit an adult. They had
Mhm.
to like bring him over from the adult hospital. So it was kind of like my dad was there as like the big guns, during the night, because most of the nurses were like they're trained for tiny kids. They're not trained for me. So
Mhm.
it was a bit of a team effort.
Mhm.
I'd say team effort, yeah.
That's so incredible that your dad was able to do that.
Hmm. Yeah, he would play kind of evil tricks on me sometimes though.
How?
So there's in the hospital, they had a scale. I had to get weighed every day. They had to check my weight constantly. And during the middle of the night, every night, I'd wake up. It's like 3 a.m. I'd eat some goldfish, and then I'd have to get weighed. And I told the nurse, I was like, I don't want to walk that far. Like, just bring the scale over to me. And my dad was like, no, we got to walk over there. It doesn't have wheels or anything. We got to go. So I'm doing this for about 2 weeks, and I'm getting better at walking and doing everything, and I get more motivated to do stuff. And my dad, he finally goes, "Oh yeah, by the way, the scale had wheels the whole time." So he was like forcing me to walk. I was like,
Yeah.
"Oh my gosh." I mean,
It's
That's
like a
smart though.
it's a very wholesome trick.
oh
Yeah.
yeah, yeah. It was wholesome. I mean, like at the time I was like, "Really? Come on." Like, but looking back on it, it was for the best, and it helped me recover.
Did you say this was happening every day at 3 a.m.?
Yeah.
Why were you being weighed at 3 a.m.?
So I was in the intensive care unit.
Mhm.
So every night in the ICU, they wake you up every 2 hours to give you a vital check,
Mm.
and I just kind of got used to that, being woken up every 2 hours. So there wasn't. It was definitely a different experience in the ICU as a neurology patient, because
Mhm.
they're always like, "Oh, you need rest. Rest is your friend." But also, the nurse's job is to come in every 2 hours while you're sleeping and wake you up and give you a vital check. So I thought
Oh my god.
I thought it was funny and very contradictory,
Yeah.
but but
That's a
yeah.
very good point.
Hmm.
You must take your rest every 2 hours for 2 hours. I have a question because you had mentioned in there that a few different doctors, like, had come in and had different, like, things to say, and you had mentioned that one of them was an oncologist.
Hmm.
And we didn't really talk about that part of it. So, um, w what was the oncology because, of course, we know that, they deal with cancer. So,
Hmm.
what did they tell you about your tumor? Did you know what it was at that point?
So the tumor I had was benign.
Mhm.
Um, my doctor explained it to me, the way it grows, like the way it got there was like through a cancerous process, but it's not cancerous. It's a bit confusing when you've had a lot of head blows in the past couple months,
Right.
but the that's how he kind of explained it. And the reason oncology was there is they were on my case because me and my parents think it's all just for money, but they were there because since it was a brain tumor and since the 1% of the tumor wasn't removed, they wanted to put me through chemo. They wanted to do radiation treatments. And we're like, whoa, whoa, whoa. Like, no, we don't need this. My neurosurgeon has a plan. And
Mhm.
like, so yeah, they were trying to take over this case. And we weren't very happy about it, but we were just like, I mean, it's all right. We also had infectious disease on my case, just because the bacterial meningitis. So the bacterial meningitis in my brain as well. They had to figure out the strongest possible way to get into my brain, because
Mhm.
your brain is literally like Fort Knox. There's no way of you getting into your brain without some serious stuff, right? So they had to get into my brain, but they also had to do like the least lethal dose in order to kill the stuff that was in my brain, the bacterial meningitis. So it's kind of a fine line they have to fight, where they have to find something strong enough to get into my brain, but something not lethal enough to kill me. So they had that to dodge. We had oncology that was on my case. They had to figure out the rest of the tumor, and it was just a lot going on. It was a lot.
Did when they initially found the tumor just from, like, the MRI, could they tell if it was benign or cancerous, or did they have to determine that after the surgery?
They had to determine that after the surgery. They couldn't tell. So they initially had plans to do a biopsy, and since it was so big, they were like, "No, let's just remove it." My gut instinct was kinda telling me, "Let's find out what this thing is before we, like, cut into myself." Because I was kinda like, "Hold on, like, let's do some thinking here. You're about to be
Mhm,
thrown into, like, one of the most dangerous surgeries that there is for your first ever surgery. Why don't you find out what it is before you kinda just go gung ho at it and just remove it, you know?"
mhm,
So I was kind of thinking rationally about it, but everyone was like, "No, we gotta remove it. It's so big. It's so big." Like, I'm just like, "No, I have a gut feeling." And I've noticed throughout the years, usually when I have a gut feeling about something, it's usually turns out correct. So in that case, it would have turned out correct, but we live and learn.
So what's the risk, I guess, with, like, a benign tumor? Is the risk that it would just keep getting bigger within that one spot?
Yeah, it will just slowly grow bigger and bigger over time. And it would start putting more and more pressure on certain parts of my brain, and I would like lose brain function, and it just get ultimately like too big and just kill me.
So if they didn't do the surgery, because you said, you were thinking like maybe we don't have to do the surgery first, like let's see what it is. Is there any way to remove it without the surgery?
No,
No. So they would have had to open up anyway.
they would have had to open me up anyways. The
Mhm.
reason that I was like, hang on, like maybe there's a non-evasive technique we could do
Mm,
since it was benign. Figuring out that it was benign, the biopsy would have showed it, and then they would have done, like, a radiation treatment, and it would have, like, not affected me as much as it did. So, the reason that I say that is because I failed to mention that the first surgery also gave me permanent double vision, and since they cut into my cerebellum, which is the center of balance and coordination, my balance and coordination is terrible. My parents call me a drunken sailor when I walk around
mm.
sometimes because my balance and coordination is that off sometimes.
I mean, this might be a very stupid question, but I assume that has an effect on you being able to play sports?
Yes. Mhm.
Yes? Okay.
Yeah. And don't worry, there are no stupid questions with me. I will explain anything. I will go in depth. Like it's all
Yeah.
good. Yeah.
So, okay, so when you woke up from that first surgery, you had double vision?
Mhm.
And is there anything they can do for that?
So they tried a strabismus surgery. That's actually it was a little later on in the story, where I
Mhm,
left off.
mhm.
So I had a strabismus surgery kind of to realign the eyes, but it got screwed up because of another surgery that's also later on. And
Oh,
yeah,
no.
Oh my god.
I'm on surgery 10 of 17.
Oh my
Oh.
god. You need to write a book. You need to
Yeah.
write a book,
I
like a cautionary tale.
I have a couple books in the works actually.
Oh, amazing.
Um yeah, I just don't have an editor. I don't have someone who could like publish it, so I'm kind of lost right now with that,
Mm.
and I'm trying to kind of build relationships in order to get myself into that position.
Well, hopefully somebody hears this because I 100% feel like your story would be so interesting to read.
Hopefully, yeah. I mean, I think that, and I think my story is pretty amazing, but I also am like, hey, I don't want to like, you know, be too cocky about it and like kind of gloat it, but
Mhm.
Mhm.
I'm kind of just like, I've a pretty amazing story.
Yeah, it's definitely a story worth telling, so it's okay to push that for yourself.
And it's
Yeah.
a lot to go through, so,
Mhm.
you know.
Yeah.
Yeah. Thank you. Yeah.
Sorry, we've just, like, push the story around so much. So let's go back where we left off, which was
The radiation treatment, surgery
yes,
10.
yes,
Yeah,
okay.
so that surgery was successful for the time being. I
And
I was
sorry, what does success mean in that case?
they got it. Like they got all the
Ah,
tumor out.
agree.
Um, for the time being, you'll figure out in a little bit why I say that. So I went on with my normal PT regimen, my healing regimen, which consisted of I would wake up at 6 a.m. I would do a footwork workout, and then I'd go to school, and then I would weightlift with the football team, and then I would do physical therapy on Monday, Wednesday, Fridays, and then I would go back to school to the football practice, do conditioning with them, and then I would do some coordination work in the evening. And then on Tuesdays and Thursdays, it would be the same. It would be a morning workout. I would lift with the team instead of physical therapy because they're only open in the mornings on Tuesdays and Thursdays. I would go to Ballard Boxing and Fitness. I would do boxing there. He works with Parkinson's patients on kind of like just the neural pathways, and it helps with that. And also, it's a great fitness method.
Mm.
And then I would go back to school, condition, and I would then do kind of like just more coordination stuff in the evening.
Was all this physical therapy kind of like, um, just to regain kind of like your normal functions, or was it also to work back to playing sports again?
It was both. Uh,
Okay.
it was well, the initial plan was to just get back what I wanted, but I wanted to play sports. So it was kind of like get back to where you can and some more. So it was a bit difficult at first. It was a very long road, but I was able to do it. I also failed to mention the first surgery kind of knocked out the whole right side of my body. So I was in a wheelchair and I couldn't really move the right side of my body. Um, it was like a paralysis. My parents say don't say you were paralyzed. I was like, I mean temporarily was, and they were like, no, we're just gonna say like it was like a paralysis. So
Mm.
I'm just gonna say it was like a paralysis, but the right side of my body it was unable to function and move. So I had to relearn how to read, walk, write, basically do just all these normal things on the right side. And
Sorry, hold on. So this all happened after the first surgery?
yes,
So how long were you in a wheelchair for after?
I was in a wheelchair for about 4 months. Yeah, 4 months. And then I graduated to a walker. And then
Mhm.
I graduated to a cane. And then I began walking on my own.
And these were the side effects of it, like, whatever they were moving around in your brain, it was affecting some sort of brain functions, right?
Yes. Yes.
And
Mhm.
so when you say you had to, relearn to write, do you mean, like, physically just, like, how to do it with your arm?
Yeah, just physically how to do it with my arm. So
Mhm.
at first I had to hold my arm down because my arm would like fly everywhere. It wouldn't like I didn't have any coordination whatsoever.
Mm,
And then it slowly got to I can write. I don't write with my right hand. I'm now ambidextrous. So
mm.
before I was a right-handed person, but since the right side kind of got knocked out, I relearned everything with the left side of my body,
Wow.
and so now I'm basically ambidextrous, which is
Mhm.
pretty amazing.
Yeah.
But yeah, so um, after the radiation, so the radiation surgery happened in May, and
Mhm.
then I went all the way to August without a surgery.
Can I interrupt you for 1
Hmm.
second?
Sorry, we
Um,
have a million
yeah,
questions.
there's just, like, so many things. So,
Yeah.
when you say radiation surgery, so do they, like just this is my brain thinking what it is, but I could be totally off. Is it like they open you up and then they, like, shoot radiation in, or what's happening?
No, so the gamma knife surgery is it's like a radiation. It's more like a therapy, but they call it a surgery. So what they do is they take an MRI. So well, first things first is they kind of put you into a twilight phase, and they drill in a halo into your head, and then they like kind of hook you on a backboard, and they take a pinpoint MRI, try to get everything to be as exact as possible, and then they stick you into this other machine that does the radiation, and they do all the radiation from a computer. So it's
Whoa,
yeah,
that's wild. You
yeah,
said that so casually. Wow.
yeah,
I mean, that's like one of the even just like through my own journey with everything, like what was always so surprising to me was just like the weird situations that you would find yourself in doing all these like treatments and surgeries and like radiation and whatever. It's always some like weird machine and you're getting like some weird thing happening to you, but yeah.
yeah. There's a couple of weird stories I have at the hospital that I didn't tell, and I don't know if I want to, but well, we can save that for later if you want to hear them.
Yeah.
Sure.
We definitely wanna
Yeah.
hear them, but you can jump
Yeah.
in if you feel like telling them and no pressure either way.
And
Yeah.
they're very weird. You're definitely not gonna wanna miss these stories.
Okay, now I definitely
Yeah.
want you to tell them.
Yeah. I'm so curious.
I will tell you after I finish.
Okay,
Sure.
done. Fair enough, fair enough, fair
So
enough.
so everything was good from May to about July, and then early August, I started getting I don't wanna say morning sickness, but it was kinda like a morning sickness where I'd get sick in the morning and I'd be fine in the afternoon. My parents
Mhm.
were joking around, calling me pregnant, and I was like,
I
"That's"
knew that was coming.
I was
Yeah.
like, "That's impossible, mom. No." They're like, "Well, with the outcomes you've had, it might be true."
Anything's possible.
I'm like,
Yeah.
"Great." So it turned out actually, so I got another surgery, but the reason that the surgery was performed is it turns out the radiation, um, since he put in such a heavy dose, like it wasn't a heavy dose, it was supposed to be a normal dose, but my body overreacted to that dosage that he put in, and it created a cyst in my brain, and the cyst started swelling up with fluid, and it started pushing on other stuff, so the nausea and vomiting nerve and,
Mm,
bounce and coordination was kinda going a little bit, and that's what caused my next surgery, which was kinda monitoring the ICPs, because we didn't know at the time what it was. We thought it was the ICPs, which stand for intracranial pressure, which is the pressure inside your head.
mhm.
So we thought it was that at first, and then he explained, "Oh, it was the radiation." So he was like, "Yeah, we'll give you a steroid to kinda, like, bring the swelling down." And then during that time, that's when I had my eye surgery, the strabismus surgery, and then after about a couple months, he was like, "You can't be living on this steroid forever." And that's when he decided, "Okay, we're gonna go in and we're gonna drain the cyst out." So I was back in the OR on the operating table, and he had to cut the back of my head open again and like drain the cyst. So after that one went a lot smoother than the first craniotomy, um, by a mile. I was only out for I think a couple days, and yeah, it went super smooth. The strabismus surgery, it kind of fixed the alignment in my eyes, but that surgery kind of reverted it. So it kind of
Mm.
screwed up that surgery, and I was like, okay. And we also figured out that surgery paralyzed the right side of my face.
Hmm.
Yeah, so yeah, it wasn't too good for me after that one, but we were just like, okay, we just keep plugging away. And that was when like a lot of things sort of happened. That's when I kind of got cleared to go back to playing football full time with like no restrictions at all.
Hmm.
And I basically had no symptoms and I was good.
Wait,
And
so, at this point, I know you said that the eye alignment was fixed and then it kind of reverted. How do you deal with the double vision? Like, do you wear contacts? Like, what's the like, is there something that can help you?
no, there's nothing that helps me. I've had double vision for so long that I've train my eyes to kind of ignore one of the images, but
Mm.
use all the auxiliary uses of that eye. And so basically, like, yes, I can see two of you if I use both eyes, but if I choose to use my dominant eye, which is my left eye,
Mhm.
then like I'm good. I see one, I see normally.
Hmm.
That's incredible.
Hmm.
Mhm.
And your peripheral vision, do you find that you can use it properly when you do that?
Yeah, I can use
That is incredible.
all the auxiliary uses of the eye perfectly fine. I have perfect peripheral vision. Well, not perfect, but I have good peripheral vision. Um, like my eyes, they're doing great and can be better.
That's incredible.
Yeah.
Wow.
Mhm.
Sorry, I interrupted you. So you had just gone started going back to football, no restrictions.
Yeah, no restrictions. Everything went well. I played my senior year of high school for football, and then I went off to college to play football. So a year later, in 2019, that's when my neck surgery happened, and that was these next two surgeries, my 14th and 15th. They were kind of just cosmetic surgeries for my face. So the right side of my face was paralyzed and it was drooping down.
Mm.
So my like the plastic surgeon I went to, he's one of the best surgeons in Beverly Hills, and he does awesome work. And
You're in the right place for that.
yeah,
Yeah.
yeah, I was in a great place for it. But yeah, he did both my surgeries. So one in December of 2019, and then the following year, December 2020. That was a whole different experience. The 2021, because that surgery happened at the tail end of COVID.
Mm,
So the hospitals were still kind of like, oh, we can't have people staying overnight. So my hospital room, in air quotes, was the Beverly Hills Hilton that night. So I was able to kind of walk around. And that was the hotel that Whitney Houston OD'd at. And since I was so high on drugs, I asked the worker, like, straight to his face, I'm like, is this the hotel Whitney Houston died at?
Oh my
I
god.
just asked him. He was like, "Not allowed to say anything about that."
no
But
comment.
yeah, but like it was national news that it happened there. So,
Yeah.
I yeah, it was just me being high and just yeah. But everything went
And
well after. And
amazing.
oh,
That's
sorry.
what I was gonna ask is like how those two surgeries went.
Yeah, it went well. They went well. I'm getting function back in the right side of my face slowly. But it's getting there. It's getting better. It looks a lot better. Even now, it looks a lot better than what it did. Before my right side, it would just droop down, and it you would notice. And now
Yeah.
it's kind of hard to notice unless I like talk or I do a big smile, and that's when you
Yeah.
typically notice.
Yeah, it's definitely not noticeable.
Thank you.
Like,
Yeah,
yeah.
yeah. So those two surgeries consisted of the plastic surgeon. He took a nerve out of my ankle, right?
Mhm.
He took the nerve out of my ankle and he put it in my face. That was the first surgery.
Our body is so fascinating. Like, I'm shocked that that's a thing, but that's really, really cool. Okay, go
Hmm.
on.
Yeah, he did. He took the one of my nerves out of the ankle and grafted it across my face to kind of
Mhm.
provide stimulation to the right side of my face. And then the next surgery was he took a nerve out of my neck, or he didn't take it out. He like connected it up here out of my neck. And he also took the TFL, which is tensor fasciolata. That is a tendon that you don't really need in your quad. And he put that in my face as well for more tone. So those with those all connected and kind of giving me more tone, that's how my face is able to look as good as it does. Without it, it would look pretty bad.
That's so fascinating.
Thank you.
It just is because 'cause I'm like, how did they even know to but anyway, I'm very happy for you because he did like a really great job.
Thank you. Yeah, yeah. He's awesome. He did a great job. I visit him every year. We just have checkups and just to make sure everything's good. And then so after that, I call it a surgery. I count it because 17 is better than 16. But I got my wisdom teeth removed. It's not really a surgery. You know, a couple years
We'll
later,
allow it.
I got my wisdom teeth removed. Big deal, right? But and then I go into a football season. But before the season even started, that's when I started peeing blood, and it turns out that my kidney stones came back. So I needed a surgery to get those removed and out of my body. So that was my last surgery. Hopefully
Mhm.
final, but based on everything that's going on with me, I don't know. Um, but yeah, 17th and final surgery so far is the kidney stone surgery.
What year was that one?
That was last year. That was in 2022. So the
Okay.
first 13 surgeries happened within 364 days of January 23rd of 2017.
Wow.
Yeah, so I was averaging a little more than a surgery a month. Um,
That's a very
Wow.
sports term of you, but
yeah,
yes, I hear you.
yeah, and then and then the next surgery didn't happen till late 2019, and then late 2020, 2021, nothing, and then summer of 2022, that was the very difficult surgery of wisdom teeth, and 2022 late was my kidney stones.
So are the kidney stones definitely related to everything that happened prior, or is it possible that you just have kidney stones?
Yeah, the kidney stones were related to prior
Mm,
because I
mhm,
never had a problem before for all 17
mm,
years, and then all of a sudden I had a problem. The thing with the kidney stones last year was they were definitely there for a while because
mm.
universal size for me is golf ball, right? That's the size of the kidney stones.
Yeah.
So golf ball size kidney stones, golf ball size brain tumor, you know.
Your kidney stones were golf ball
That's
sized?
Yeah.
yeah, that's
Whoa.
huge.
Did you not feel that at all? Like, prior to seeing the blood?
No, so
Wow.
we have speculations of when they kind of started to get too big to pass, and that was in 2019 after my
Mm,
first facial surgery.
mm,
And I would notice that when I worked out super hard and I would do a lot of movement, that I would have bloody urine. But me and my dad, we did some digging on the internet and kind of found out like, oh, it's probably hematuria, which is the presence of blood in the urine. And we were just like, oh, if you work out too hard, you get that. And we were like, yeah, that's probably it. So it would happen ever so often. So like every like 3 or 4 months, it would happen, and it started getting a little more rapid as I picked up my workouts, like every 2 months, and then every month, and then the
mhm.
first 4 days of my fall football camp, it happened, and I was like, okay, this is the first time it's ever happened 4 days in a row. I might want to mention this to someone. So
Yep.
I talked to the trainers. They sent me to urgent care. That's when they found I had a kidney stone, and then that's when I also found out the medical system is very slow at treating people if it's not urgent. And that's kind of how this whole ordeal wrapped up so far.
How are you feeling now?
I feel fine now. I feel like $1 million. Well, I mean,
That's so good.
based on my medical payments, five, but you know,
And are you still at college?
I am. Yes, this is my final year at Chapman University.
Amazing. You're still playing football?
No, I left earlier. The coach told me I wasn't going to get a lot of playing time, and I kind of had a pretty, some people say it's difficult, but it was pretty easy. It was an easy choice for me. It was either
Mm,
stand on the sidelines, beat up my body scouting against the starting defense and get disrespected by about 85% of the team, or enjoy my final year of college and do something that I actually want to do forward in my life and kind of enjoy. So that the way I put it kind of made that process very easy. Of course, it was hard at first. I didn't want to leave that sport just
Yeah.
because I really loved it, but I it was time.
Did you find at all that, like, having the goal of being able to play again, like, I guess, helped at all mentally to kind of rehab through everything?
Yeah, yeah, that was kind of like my main focus after a certain point during rehab. It was kind of the main point to get back. But before that, it was just get back to normal, and then after that, it was kind of like extra credit and see how far I can go.
Mhm.
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 Do you play any other sports now?
No, I stopped playing sports. So I played rugby and football in high school, but I stopped with rugby after I graduated, and then I just recently stopped with football.
I find that, the way you've, like, told the story is just, like, very incredible how, like, you were like, "Okay, let's just, like, do the next thing and move past this and, like, really, like, move from this." But how did you find your mental health throughout all of this? Because there was just so much back and forth.
Yeah, so I feel like I was kind of prepared in a way. So my high school coach at the time, he was like one of the hardest high school coaches in the country, and like the hardest high school coach or hardest coach in general that I've ever had. So 3 years of him before my brain tumor kind of mentally prepared for it. My coach, not the high school head coach, but his assistant coach, he was also kind of hard on us. And his favorite quote to say to us was "suffer in silence." And I guess that kind of got ingrained into my brain to where I was just like, just just do it. Just I mean, it's gonna suck, but just do it, right? Because life on the other end is just gonna be so much better when you make it through it. I didn't really have death cross my mind after that first surgery. I mean, the first surgery, I was freaking out. I was like, "Don't kill me! Like, I don't want to die." And then after that, I was kind of just like, "Well, I survived that. I could probably survive anything that they throw at me." So that was kind of like my mindset, and also I just took it day by day. I didn't look too
Mhm.
far ahead. I mean, obviously, I had goals in the future, but I was like, well, first you got to get it done day by day. You got to do it step by step, however it happens. And that was my mindset.
That's amazing.
I'm curious about, like, since you were so young and in high school and that whole social situation of just, like, being in high school is already challenging, but then putting this on top of it, like, how did it affect your social life and your friends and things like that at the time?
Yeah. So, oh gosh. To unpack that, I would say my social life to begin with, it was kind of difficult. I was a chubby kid growing up, so I got bullied a lot for being fat. Um, and I didn't really have a lot of friends, but joining the football team, I got a lot of friends through that, and I was able to kind of improve my social life. And right at that time, that was when I got the brain tumor. So things were looking super positive for me. And I was like, all right, things are finally going my way. And the brain tumor got discovered and everything happened, which I wasn't happy about, but you know, it happened. And I did lose some friends who were just like, I can't handle like what he went through, like it was insane. And then some people were attracted to it, and then some people stayed, and it kind of went that way. I definitely did see a deterioration in friends after my like. So in high school, I went in with the class of 2018, and since I had the brain tumor my junior year of high school, I had to retake my junior year. So I kind of got reclassed to the class of 2019. And when all those kids from the class of 2018 left, I saw a huge drop in numbers of my friends. I didn't really have a lot of friends. and a lot of people said they were my friend, but they were just, like, using me or just trying to do like, just using me to, like, get something or kinda look good for public image and, like, be like, "Oh, yeah, I'm friends with a brain tumor survivor." So it's like
Mhm.
it was a lot of usage and just, it kinda did affect me mentally. I kinda shelled up. It was like, I don't wanna be around people that are my age, and I was kinda like, I only wanna be around people who kinda have the same common goal as I do, and, like you 2, you have a goal of creating this podcast and kinda informing and talking about cancer, and, that's what I wanna do, and I just wanna be connected to people who are like-minded, wanna do what I wanna do, and just kinda, like, niche down my groups and,
Mhm.
whatnot, but I still do have some childhood friends and some people who stick around and stick with me, but, definitely noticed a big deterioration in friends.
Yeah, I mean, like, I mean, you are so young right now, and you were so young when it all happened, like, I can say it's one thing to go through it when you were, like, my age, I was 29, where you are, you know, probably have some people in your life that are a little bit mature and can kind of, like, look at things with a viewpoint of just having, like, life experience, but having to, like, go through that surrounded by people that are immature and dysfunctional because they're teenagers, like, that's a whole other thing to deal
Mhm.
with. So, it doesn't surprise me to hear that, but it makes me a little sad, I guess.
Yeah, it's it's kinda sad, this whole experience, I would definitely say shot up my maturity by a lot, in a positive way. But since I was so young and I had a very mature outlook after it, I'd be, for example, I was in college. I was going to bed at like 10 or 11, on a Friday night. Meanwhile, all these kids are out partying and drinking and having fun, and I'm sleeping. I'm like, I just want to get through college. I kind of want to, move on with my life. And, the example I have is one night I wake up at 3 a.m. having to use the restroom, walk outside, and there's a kid so drunk and so high that he's just on the floor, just sleeping. I'm just like, this is not real life. Like, what is going on, And, I
Mhm.
mean, it that makes kids happy, I guess. And, I mean, I don't say anything about that. Obviously I don't like it, but, if it makes them happy, it makes them happy. I don't care. I'm not one to say like, "Oh, don't do this," but
Yeah. Yeah, I think there's people who go into college with different mentalities. There's definitely people who wanna get the party thing out of it, and some people who do wanna get the, like,
Mhm.
knowledge, but, like, education of self, like, understanding self and, like, what you want, and I sometimes find it's, like, a little bit easier to find your tribe in college if you're, pursuing the classes and the things that you like and the sports and those things, because then you do kinda have an easier time. Did you have a little bit of an easier time finding a tribe in college?
Not really. Um,
Mhm.
so since the colleges that I went to, they were Division 3 colleges, and they're not so athletics based, they're more
Mm,
kind of student life based. And I was kind of focusing on athletics. Like, I'd always be working out, I'd always be staying in shape and like keeping my body right. And all these kids, they would find me weird because I would do that. And meanwhile, they were out partying. They were just like, "Oh yeah, I act serious in front of the coach, but I really don't care." At the end of the day, so it's like
mhm,
a difference of, like, interest. It's like I don't
mhm.
find any of that stuff appealing. Like, yeah, I'll be there to talk to some people if I ever feel like super lonely, but it's like I I already have this life. I already have some things going in my direction. I don't really have time for that. I kind of want to build what I have going on, what I have, like what I'm doing. And
Yeah.
it was just it's just hard because even the older guys, that's kind of their mindset. Oh, I just want to have fun with the team and drink, and I'm just like, no, I don't want to do this, and you know that kind of made me an outcast to some of the football programs that I was a part of.
Mhm.
And then also the fact that, I need more sleep. I can't do things early. So they would have kind of like a running group at 7 and a running group at 10. I would always go to the 10 a.m. group because I needed my sleep. And sleep really
Mhm.
affects, the brain, right? And I'm just I'm just like, yo, I can't hang. I can't go out to 3 a.m. on a Saturday and then you expect me to be good, that following Monday. Sleep catches up with you, and with me especially, it'll catch up. So,
Mhm.
Mhm. It's almost like a, privilege of ignorance in a way. It's like, you know, it almost also sounds to me like if you were, like, a 30-year-old or if you were like me or Eva, and then you, like, went back to college with, like, a bunch of, like, 20-year-olds, that would not be an enjoyable experience. Like, I
Yeah.
think you're just, like, in a different space mentally because of everything that you've gone through, and, you just have different priorities, which is not a negative thing at all.
Nor is that weird. People just suck, but
Yeah.
anyway.
no, I mean, that's kind of the situation I'm in. I mean, I'm a couple years older for the class that I'm in. I should have graduated like a year ago. If all of this didn't happen, I should have been at like, you know, I I would say that looking back on it, there is kind of an aspect where I'm like, "Oh, thank God I didn't go down the path that I was going down, and thank God I had this brain tumor." But, if I was to go down that path, I would probably have graduated from an Ivy League school, playing Division 1 football, and just, being a normal worker or an engineer or whatever, I could do so much more things. Like what I'm doing now is like I'd rather do that than being an engineer. I'd rather like
Mhm.
impact people, or the just even thinking like maybe there's someone out there that I can impact. So I'd rather do that than, you know, be like, yeah, an engineer making a good salary, and I mean, not that they don't help out people and they don't change their lives as well, but it's kind of like I'd rather, inspire people and create change.
It feels like this gave you an opportunity to be really intentional with the path that you're setting out for yourself,
Hmm. Yeah.
which a lot of people don't even know how to do, especially at that age. I feel like with like college or university or whatever, you just get thrust into this whole new world
Hmm.
and you have no idea what you're actually choosing for yourself. So there's something really great about you being able to set your path like so early on, and you'll find people that are on that same path, you know? Like Des said, we too are 10 a.m., 10 p.m. bedtime kind of people.
Yeah. Yeah. I mean, it's, I mean, it seems like just the most stupid things that I follow, but it's like those things are the best for me, and I follow it.
100%. It's your own life. You have to live your own life. So, and it sounds like a lot of the people that are around you aren't. So they'll realize that later.
Yeah, it's a maturity level, they're a
Yeah.
bunch of 18, 19, 20 year olds wanting to have fun, wanting to party, and I mean, all parties are basically the same. Everyone gets drunk, they all do whatever after, and then they wake up in the morning not feeling good. Same thing over
Yeah.
and over. I don't know how people can have fun doing that.
Well, you have a great insight. I'll say that it took me many years to realize that. So,
Me too.
yeah.
Maybe you wouldn't have liked me in university, but
It's not that I don't like those people. It's just like I like they're great people. Don't get me wrong. I like they're the most down to earth people. It's kind of like trying to find like a real world example. You know, it's it's kind of like in religion, right? I think it's Muslims that do Ramadan, right? If I'm not mistaken.
yeah.
it's how people practice. It's like when they practice Ramadan, they do something different. They do it differently because their morals, their beliefs, right? So it's kind of like, okay, well, it's my morals, my beliefs, where I just don't find it interesting. You know, yes, they're great people. Yes, I'd hang out with them like during the day, but I don't want to participate in what they're doing.
I mean, that's fair.
Yeah.
It's not for everybody.
Yeah, it's for
And there's a whole and I feel like when you go through a cancer diagnosis or a tumor diagnosis, like, you're probably a little bit more health aware and, like, there's anxiety and things that come with that too, that, like, you have to deal with that they don't
mhm.
necessarily.
Yeah, well, the thing that also didn't help is that I commute. So I commuted like 30 minutes and then now it's 20 minutes. But so say we're at a party and we're out till like 1:30. Some of these kids go home, go to bed 1:45. I don't go home till like 2. I've got to make sure everything's good. So I'm not in bed really till about 2:15, 2:30, where they have an extra 45 minutes of sleep. And that's also with the waking up aspect. If they wanted to go to 7 a.m. running, so to say, they would wake up 6:45, be at the school at 6:50, and they'd be on the field being able to run. I would have to wake up at like 6:15, 6 o'clock, and then I'd leave at like 6:15, get there 6:45, then I'd run. So I'd be losing about 45 to an hour of sleep every day versus, being able to just be there.
Right.
So
Yeah, that makes
yeah,
sense.
so it was difficult, but it made me kind of realize some things and kind of become the person that I am today. And although it did suck, I'm thankful for that opportunity. And just how I explained, even though this whole brain tumor journey and this whole process sucked, I'm very thankful for what I was able to go through and what I'm able to kind of thrive through and see how strong that I truly am and what I can go through. So this process really kind of made me take a step back and be thankful.
That's amazing, and you sound like you're so prepared for adulthood and, like, the next stage of your life. It sounds like you're going in it with a clear head, which is amazing.
Thank you, but I am not prepared whatsoever. No, please.
You know what? That's okay. I don't know if anyone is ever prepared for any stage of
Yeah,
life,
well, you
You
but
sound
guys,
more prepared than anyone I've met your age
yes.
or what I was at your age, so
Yeah.
yeah.
you have a leg up.
Well, you two just visited LA. Am I mistaken or?
We were in LA recently,
Yeah,
yeah.
you know how expensive it is out here.
Mhm.
So
Yeah,
it's like it's not even a basic income can like make you live comfortably out here. And
yeah.
Mhm.
this is gonna sound like, kind of entitled me, but I've never worked a day in my life. I live with my parents still, and it's A, because it's too expensive, and B, it's like very competitive out here. So it's just, I feel like it's not a good place for someone who is growing up to grow up. Like, kind of learn, like,
Mm,
oh, like you should do this and like make your income this way, or like it's kind of like, oh, you must like you have to be successful, and they don't tell you how. Basically,
mm.
it's very different.
I mean, I think we're all facing like, everyone in our generation and I don't know if I don't think we're in the same generation. I think you're a Gen Z, right?
Is
Um,
99 Gen Z?
I don't know. Probably.
I think
I
Oh,
f
wait. Is 90s millennial? Is just all 90s millennial?
Hang on, guys, I will check.
is
Okay.
I thought
What
9
is Gen
I
Z?
thought 90 I thought 98 ended millennials and then 2000 picked up Gen Z. I
Okay.
think we're
That
like
would make
Oh,
just
sense.
so mid to late 1990s is when Gen Z starts
oh wow. Well, never mind. Then I'm Gen Z.
and goes
Um,
into the early 2010s, and then now it's Gen Alpha, right?
I
there's a new
think
one?
I don't know. As a
I
former
mean,
member of Gen Z, I do not want to be a part of it.
Sorry, you're a permanent member of Gen Z, all right?
I do not accept.
Um, but I think everyone in our generation is, like, facing unique challenges with the current economy and
Mhm,
everything. I think what we if you grew up lucky enough to have, like, a house and, things like that, I think it seemed like a given maybe that you would have that as an older person, and we have to face the reality that it's a lot harder now than it was for our parents. So I think that's just a universal feeling.
Especially in larger cities, like, we live in Toronto and, we face the same issues, like,
mhm,
rent here is insane, cost of living is really high, and people have the same problem where you could have a full-time job and just barely be making it by, which
mhm.
is so crazy to me that
I
that's where we are, but
I mean, I'm 33, I have a partner. We've been together for 10 years, we're, like, about to get married, and we live with 2 roommates.
Oh,
So,
wow.
yeah.
Yeah. Yeah, I actually I was listening to I forgot what podcast it was. I was listening to it, and they were talking about how we are actually in, like, a much darker time than the Great Depression. Like, we're, like, more in debt because they did, like, like, the average income back then, our average income, and they kinda, like, because obviously, cost has gone up with everything, but they've kinda translated the numbers out, and we're actually living in times that are less than the Great Depression. So we're actually living in times worse than it. Like, our economy is doing worse, apparently. That's what I heard. I'm not an expert, so I don't want
I'm
anyone.
now gonna have to go down this rabbit hole, thank you
Yeah,
for that.
sorry. I was I just yeah, I don't know, just the cost of living. We kind of went on a tangent.
But actually on this topic, I did wanna ask, because we're in Canada, so we have, public healthcare, so a lot of our healthcare is covered, but I know it's different in the States, so I did wanna just ask how that impacted, like, your family.
So we have an amazing insurance company that covered about I think it was 95% of what I had to pay.
Oh,
So,
good.
or I think you have to pay up to 30,000, and then after that mark, everything is just it's on insurance. So, when I started getting into the millions, that definitely helped.
I mean, yeah.
Yeah.
Whoa.
Do you know the total cost?
It's somewhere around 5 or 6 million.
Wow.
That's unbelievable, and I will say that a large part of that is, like, doctors having to redo things.
Mhm.
So,
Yeah.
that's
And
wild.
also some of it was, like, trivial stuff, like, say oncology had to go visit you in the hospital, they would charge you for a full visit. It's like, you guys walked in for 5 minutes, asked me how I was doing, and walked out, and they would charge us.
Mm,
So it was kinda
Mm.
trivial stuff like that that we had to pay for, but at the end of the day, I'm here. I mean, our financial situation is okay, I hope, and
mhm.
yeah, I'm able.
Was that insurance through one of your parents', jobs?
Yes. So my mother, she worked for the state fire agency. So it was
Ah,
insurance through that, and they worked and they gave us pretty good benefits, which I'm very thankful for.
that's
Mhm.
Yeah.
amazing. Thank God.
In terms of just, like, support, what did you find kind of, like, helped you through everything? Like, I feel like it's different for everyone. Some is, like, support people or just, like, activities that made you kind of helped you through it.
Mhm.
Was there anything that kinda stands out for you?
Um, Nothing that really stands out. I know I've had a group of people who visit me. They visited me. There's like a certain 8 or 9 people who did, and that are supportive of my journey. Uh, Actually, my high school coach, who we thought was all about football, he visited me, and he was actually a very nice and genuine person. And I figured that out when he wasn't screaming and yelling at me. He actually brought me, it's so funny. So he asked me, he was like, "You want me to bring you a protein shake?" I was like, "Yeah, sure. Just bring me a vanilla shake." And he brought me a shake from In and Out, which is a fast food burger chain, which
Oh, that's good.
yeah, which is which I think was pretty cool. But it's just like,
I love
yeah,
that.
it was just the small things like that that I will remember and I will cherish and I'll be thankful for. Like, when I went to school before my first ever surgery, I remember my coach, he came up and he just started rubbing the back of my head. I'm like, "What are you doing?" He's like, "I'm trying to rub the tumor out of your head." It's
Aw.
just small stuff like that that I'll cherish and remember. It's pretty amazing.
It's really always interesting to hear the ways that in which, like, the community shows up, and people navigating caregiving is really difficult,
Oh
and
yeah.
it's beautiful to hear when the things that people do really resonate.
Have you been able at all to connect with, like, anyone else that has gone through something similar? I feel like it's a pretty unique situation, but
Yes and no. I've connected to some people, but the thing is with the brain tumor I had, so I had a stage 2 ganglioglioma, and that brain tumor, it accounts for about 0.1% of all brain tumors. So it's a very,
Wow.
very rare brain tumor, and I I connect with people that have had brain tumors, and I encourage them and I inspire them. But there's also a program that I do. I'm a part of the Pediatric Brain Tumor Foundation in the States. They have a like a peer-to-peer mentorship group, and they kind of pair you up with, people who've had similar brain tumors. So if you had an astrocytoma, you'll get paired up with an astrocytoma survivor or a parent of an astrocytoma survivor. And they will mentor you for, I think it's 8 weeks or 10 weeks. I can't remember. It's just been so long since I've kind of like been a part of it because since my brain tumor is so rare, no one has signed up with a ganglioglioma. So I've never
Mm.
really seen, like I never got to mentor anybody really. But I
Mm.
am a mentor. I'm out there. Feel free if you find my social medias, feel free to reach out and I'll help you out. I'm a very I don't want to say wise person, but I'll help you out. I kind of have some knowledge with what's going on. I'm not going to tell you exactly what to do because I feel like there's not a proper way to do things. But I will help out and give guidance to people.
that's great. I feel like, even people that didn't necessarily have the exact same type of brain tumor could
Really
still,
benefit.
yeah, benefit.
Mhm.
Yeah. Did they ever say anything about, how that tumor formed? Like, why you got the tumor? Like, did you genetically have anything or
So there's two possible explanations. We don't know either of them. So the first one was I was born with it and I just had it since birth and I've just been going
Mm,
through life with it. And then the second one was during puberty. That's when it started kind of like multiplying and growing.
mm,
Both are, you know, pretty reasonable solutions, or I mean not reasonable solutions, but like reasonable explanations.
mhm,
And I mean I'm gonna believe either of them. We don't know, just because we just don't have the insight in it or the technology right now to see how long it was. But those are the two explanations that we can come up with. But we don't think it's from anything else. I mean, looking back, it could be the food I ate because food and sugars cause cancer. Um, it could be, like radiation just from like cell towers or power lines if I was near them a lot, or we don't really know. So
do you know if it's genetic in any way? Were you genetically tested?
I was not genetically tested. I need to get genetically tested because I have. some things that still go on with me that are unexplained and kind of weird, but
Mhm.
we don't think it was. But if it was, it was.
Mm.
We'll find out soon enough.
Yeah, we talk to a lot of people about genetic testing. It's interesting. Actually, the majority of people we've talked to don't have any genetic predisposition, even if they've been tested. But it's just always interesting to know. Um, and before we let you go, you had promised us stories.
Yes, the two
So
stories.
have we earned
Yes,
them?
you have earned them. Yes.
Okay, great.
And if you stuck around long enough to hear this, that is very amazing.
Yeah.
First off,
It's a really great
yeah,
conversation, actually. I'm finding it very
yeah, an
interesting.
hour and 30 minutes of just conversation. My story. I've never explained the full story without leaving parts in under 10 minutes. Like it's a pretty hefty story.
Yeah.
So
Mhm.
being able to get it down in an hour and 30, that's good. But yeah, so the stories. Um, I wouldn't say they're like, I don't know if you would call them fun. Actually, you know what? I'll tell you three stories. I'll leave in the funny story for the last one. So the first two stories both happened within, I believe, 72 hours of each other. So the first story, kind of more of an embarrassing story, but it's I promised it and I'll tell. So I was it was when the medication that I was on was defeating the bacterial meningitis. And so what the bacterial meningitis did was it would kind of like burst and it would raise my body temperature when it would, die off. So it caused me to have a really high fever. I think my fever was at 105 at this point. So I was in a lot of distress and I was very uncomfortable. And the only way that I was comfortable was it felt I was just 100% naked. I threw my hospital gown off and I wouldn't cover up and I would go around like they would wheel me around the hospital. I'd just be naked. So they would just I'd just be going around the hospital naked. I'd be in my bed naked. I wasn't thinking. Um
Whatever. You need what you
yeah,
need, you know?
yeah.
You're just trying to get
At
better.
that point I was like, get me cooled. And then
Yeah.
about you know, in the time frame of 72 hours later, as this is where the second one comes in. They put me on something called a cooling blanket. They put me on this blanket. It's about 30 degrees. I'm lying there. I'm still naked, by the way. I'm lying there.
72 hours later, no
Yeah,
clothing.
still no clothing. Um, and I'm on this blanket, and they have to get an accurate reading of my body temperature. So they stick this. I don't know what it was, but they stick like this probe up my butt in order
Oh my
for
god.
me for the blanket to work and like to cool me off. They had to put me on this blanket with a probe up my butt. So yeah, those
Oh.
are
This being a pediatric hospital, I feel like they could have really figured out a different way to do this for you,
Yeah.
but oh my god.
Yeah.
uh,
Oh,
well, I
man.
mean, the way they read like really small pediatric kids' temperatures, they stick the thermometer in the butt. So I guess they were like, "Oh, this is protocol." And
This is all that we do. Yeah,
Yeah.
this is
yeah, we're
protocol.
just following
Oh my
protocol. I
god.
mean, even though you're 17 years old, this is protocol.
I mean, I guess they're letting you be naked, so you're like, take what you
Yeah,
Yeah.
know.
whatever, whatever. I guess so. So those are the two stories that I was kind of talking about. That I was talking about, but the one funny story I'll tell right now is so after my 13th surgery, they moved me to a room. It's kind of a two-part story, and they put me on a dilaudid pump, and you guys know what dilaudid is?
Mm-mm.
It's a very, very strong narcotic.
Oh,
So
okay.
they put me on a pump with Dilaudid, and me being me, I like how it made me feel. I was just clicking that thing like it dispense M and M's, right?
Oh no.
So that thing would flush, right? And when I was on it, Since it was a pediatric hospital, they had clowns walk around the hospital, kind of, bring
Oh
joy.
my god.
And when I was wheeling, I would like freak out because I was so high. I would think like the clowns are everywhere and like they're hiding around the corner to scare me. I'd freak out.
Oh my
And
god.
when they wheeled me into, the ward, they took me to the mini ICU. They have another ward that's intensive care unit. One of the kids, me being high, looked in that room and I was like, why is he wearing a gas mask? Right?
What?
My body was hallucinating him having a gas mask on. I was
What?
I was tripping. And then they bring me in the room and they tell me, they're like, "Yeah, we'll send you home tomorrow if you get off the Dilaudid." So I went cold turkey on that, right? Like one of the strongest narcotics or one of the strongest opioids. It's an opioid,
How
right?
did you even have
Oh my
access to just give yourself however much of it you wanted?
There they gave me a pump. They were like, "Oh, only press this if you need this." And I was like, "No, I'm
But,
clicking
like
this."
Here you go, 17-year-old,
Yeah.
yeah.
like, Jesus.
Yeah. Oh
Yeah,
my god.
some miscommunications, I guess. So I went straight cold turkey from having a strong dose to straight cold turkey. And
Oh my god.
in Alzheimer's patients, they give them Dilaudid, and it's called sundowning. So when the sun goes down and they're looking at just four white walls, they start hallucinating. So the first night, there was a building kind of being built across the way, and I look over. I was like, "Oh, there's a security guard on duty." There was no one there. First off, and then I look over again, and I see a bunch of people, a bunch of like '80s hipsters, kind of like rolling in, like bumping out music on their beatbox, and you know having a
Oh my
party.
god.
And I was like, "Oh, they're having a party over there." My dad looks over and he's like, "What?"
Oh my
And
god.
then I was like, and I looked over again. I was like, wait a minute. I thought they were having a party, and it turned into a gym. There was people working out, right? So they were
Oh.
working
Oh my
out,
god.
just having fun, just doing their thing. And then after their sets, they would jump off. They just jump.
The
Yeah,
building?
they jump off the building,
Oh my god.
and I just see them just disappear. And and then it go back to just an empty room, and I wouldn't think anything of it. So
You just casually thought like, "Oh, that's happening."
yeah, so I wake up the next day and they're like, "Okay, we're gonna keep you in for some testing. You'll be able to go home tomorrow morning." All right. So I'm off the Dilaudid, but the effects did not wear off. So in the four white walls, right? It's called sundowning. When the sun goes down, start hallucinating, and I started hallucinating that I was in the game of Grand Theft Auto 5, like full on hallucination, right?
That's
Oh yeah,
dangerous.
it
That's a
it was.
dangerous
It is a
hallucination.
dangerous hallucination, and that's not it. So I'm thinking my friend's coming to pick me up on the mini map, right in the bottom corner, and I can tell you exactly where I was. I was at the bottom of the mountain of Mount Chiliad at the Sandy Shores Hospital. I just got released, right? I'm
Oh
thinking
my
that,
god.
and I'm like, "Oh, yeah, he's coming." He's like my dad's like, "What are you talking about?" I'm like, "Oh, yeah, he's coming to pick me up, and then we're gonna leave." And my dad's like, "No, you're in the hospital." I'm like, "No, I'm not." And then I start getting angry. He's like, Okay." Like, um, calm down, Zach." Like, he didn't know what to do because, I'm much bigger than my dad too. Like, my whole family's about 5'4". I'm 6 foot, 6 foot and a half.
Oh my
And
god.
I'm like, I've got muscle on me as well. So it's like, yeah, I'm bigger than my entire family. Like my dad's like, "Okay, we're about to have a kid hallucinating out of his mind, super angry." Because he's seen me when I get
Great.
angry. Like I can get angry, but I
Mhm.
choose not to. But I can get angry, and then me and my dad, our conversation kind of escalated, and I'm like, "Shut up, Dad! I'm out of here." I rip my IV out, just rip it
Oh
out.
my god. Like a
Oh!
movie.
And I thought I was walking out the doors, and I storm off into the bathroom.
Oh my god.
Wow.
And that was the end of that story. And then
Wait, that cannot be the end of the story. What happened in the bathroom?
I don't know. I don't know. The next recollection that I have is me at 4 a.m. on the phone with my mom saying they're gonna take me to jail. And the funny thing was, that next morning, completely fine, and they released me from the hospital.
Oh my
Did
god.
they, like, know that this was gonna happen? Like, were they expecting you to have this
They were like, "Oh
reaction?
yeah, it's called sundowning. It's a typical reaction in Alzheimer's patients. He'll be fine by morning." What? What?
That's
That's
unbelievable.
It's like,
insane, yeah.
what? I literally just was like on the verge of being put into a psychiatric ward, and they released me because I was fine the next
That's
morning. I was
wild.
like, sure.
Did you feel fine though? Like, did you have any, like, flashbacks of that at all?
I remember everything, but I felt completely
Mm,
fine. I was like, yeah, I'm
that's
I'm
wild.
normal. I'm good.
So it was like a little 24-hour party in your head.
Exactly. Yeah. Yeah. It was quite the party.
Oh my god.
Yeah.
Well, thank you for telling us. That
Yeah.
was really
No problem.
funny.
Leave you on
Um,
that positive note, because I know how doomy and gloomy my story can be sometimes.
honestly, it's very inspiring. Like, I mean, it's the way that you're delivering it and the way that you're telling it, it's like it's so heavy, but you tell it in, like, a very inspiring way.
Thank you. Yeah, and if I could leave you guys off with some more inspiration, I want to say
Yes, we'd
it's
love that.
so a couple things. Um, always be thankful for the opportunity that you have, even if it looks like it's not an opportunity and it's kind of like hell. Kind of just be thankful for it, because in the long run, you'll be thankful that you get what you get out, right? I'm thankful of my brain tumor journey. I'm thankful I went through all of that. I'm able to see how strong I am. I'm able to see my outlook on life, and it changed my outlook for the better. Um, and I'm super thankful for it. And also, they teach us this in training for the peer to peer mentorship, but it's the analogy of the storm. When you're going and seeing a storm coming at you, you have two options: to run away or to go through it, right? And if you run away, that storm is just going to catch up to you. It's just going to come back at you,
Mhm,
right? So you've got to go through the storm one way or the other. No matter how heavy it is, no matter how light the storm is, it's going to happen. And when that storm happens, if it's very destructive, how my whole journey was, how it was very destructive, you go, okay, this is hell. This is very destructive. It's destroying everything in my life. But once that storm passes, you get that sense of calmness, that sense of, like peacefulness and beauty out of everything. And all you can really do is just rebuild and be like, oh, this is what we need to do. Like, it'll teach you a lesson of like, oh, it destroyed this aspect of my life. So how did it destroy this aspect of my life? Not oh my god, this sucks, but okay, it destroyed, this aspect. How did it destroy it? How can I prevent it in the future from happening? So for instance,
mhm,
with me, my mindset, it led me to be so serious in football to where I didn't have that much of an outside life. So instead of saying, oh, it destroyed my football and destroyed it, instead of thinking that, I thought, okay, it kind of taught me to have this great mindset, to not be all in 100% just football 24/7, because that's how you lose people. And if you want to create these great relationships, if you want to be this person that you want to become, football can't be 100% of your life. And I also feel that's one of the things that brought me away from football that I mentioned earlier. Not only that I wasn't going to get a lot of playing time, but I was kind of consumed by it, that I kind of wanted to, I wanted to be just a starter, or I'm out of here, right? And it's kind of just like, made me into somebody who I wasn't, you know?
Mhm.
So the analogy of the storm, just like you're gonna go through something, but it's it's gonna end out peaceful and you're gonna end up okay. There's no, bad I don't wanna say I don't wanna say like there's no bad outcome because obviously there is, death. But, I'm a religious person, I believe in heaven, um, and I believe that's the peacefulness that comes after, the storm. So, if you wanna believe it, you can believe it. If you don't want to, you can just believe the storm analogy, but I believe in heaven after life, if you've been, like, a good person with good morals, and, just a bad situation happened to you. And that bad situation is like the storm, and heaven afterwards, or your life afterwards, is the peacefulness, the calmfulness, the rebuilding part. And I just want to leave you off with those positive words.
Thank you so much, that's beautiful.
Yeah, no problem.
Oh, I feel really calm after that.
Yeah, yeah, thank you. Yeah.
Um, well, it's been honestly so nice to talk to you, and I really appreciate you sharing so much of your story. It's such an incredible story. You're very
Mhm.
inspirational.
Thank you. Yeah, no problem.
Um, and I hope you continue to just feel good and, you know, adult.
Yeah.
Continue to rebuild.
Yep. Exactly. Yeah.
Yeah.
Yeah. Just rebuild every day. That's all I can do.